So yes, good evening everyone. Good evening Mudassir, Jia, Physioblocky, Vijay, Sabrina. Good evening. So yes, after one day we are meeting again, and today yes we are going to discuss the part four in. Yes. So before starting with the session, just give me a thumbs up in the chat box if the audio and visuals are perfectly fine. Johra, good evening, beta. Good evening. Yes. Yes, just give me a thumbs up in the chat box. Yes, Johra, Physioblocky, perfectly fine. Yeah. Medical love. Okay. Ravi Raj, good evening, beta. Vijay, okay. Okay, perfect, guys. Now, today, the very first topic that we are going to discuss over here, it is the parts of the long bone. Very important. Now, guys, when I will start with the upper limb or when I will start with the lower limb, guys, the very first thing that I will do, that is the long bones, right? That is the bones of the upper limb and the bones of the lower limb. Yes, Sunil, yes, Anil, good evening. Yes, Naveen says class early लिया करो तुम आते नहीं हो यार क्लास में जल्दी सुनील हाय yes you don't come ना that's why तो फिर रात में क्लास लेता हूँ थोड़ा तुम रात में ही जगते हो सबके सब you guys are yeah so Anjana hi Tanmay hi yes okay not an issue chalo let's not discuss all that let's come to the parts of the long bone. These parts are guys very important because we are going to study with I will be teaching you when I will start with the upper limb after this I will be teaching you each bone separately and that is the reason guys you should know all these terms. Sonu Singh good evening. Medical love I will discuss it at the end. As of now just try to focus what I'm teaching you. I'm teaching you everything from the basics. Tanmay yes. Okay. Now let us start guys. Let us start without wasting much more time. Now you guys already know that there are yeah now just try to draw along with me guys. You guys already know that we have two ends of the bone, right? We have two ends of the bone. Yes, and the ends of the bone are called as epiphyses and the ends of the bones are called as epiphyses. Very important. Yes. Now we have the long part of the bone over here and this long part of the bone it is called as the diaphysis. I would request everyone to draw the diagram along with me. Okay, use your color pens, prepare a notebook. Okay, and all the important points, all the diagrams, the line diagrams I'm drawing, kindly draw with me. I'm not no asking you to draw some fancy or some extraordinary diagrams, but yeah, the very special diagrams that I'm drawing for you, a very simple diagram, right? So remember guys, the ends of the bones are called as epiphyses. Let me just label it for you people. Yes, you guys already know. Let us suppose that this is one of the epiphyses. Epiphysis. Now, epiphysis simply means the ends of the bone. Epiphysis simply means the ends of the bone. Again, this is again another epiphysis, right? This is again another epiphysis. Now, if I have to differentiate between both the epiphyses, okay, which anatomical term I will use? For example, if you can see my arm, right? If you can see my arm, in the arm we have the humerus bone, right? From the shoulder joint to the elbow joint below, we have this humerus bone. Now, humerus also has two epiphyses, right? You guys are going to tell me near to the shoulder joint which epiphysis is there, and near to the one which is making the this elbow joint which epiphysis is there. Yes, Zara Aftar, Aftar, very good beta. Proximal George Azala, very good. Naveen, thank you so much. Yeah, yes. We have proximal and distal. I have already told you there are 2 points now. One point is at the shoulder joint, one point is at the elbow joint, guys. Now, the one which is more closer to the center of the body, it is said to be proximal, right? And the one which is away, it is called as distal. P से proximal, P से pass, P से पहले, and D means distal, दूर. It is away from the center of the body, right? So yes, Hina, very good. Yes. So we have the two epiphyses, and the two epiphyses can be simply differentiated on the basis of proximal and distal. So let us assume that this is the proximal epiphysis and this is the distal epiphysis. Let us assume as of now over here, yes, the distal epiphysis. Now we have the two epiphyses. The epiphysis simply means the ends of the bone, the ends of the bone, ends of the bone, right? Now, coming on to the next part over here. Yes, just try to see, guys. We have another part over here. Okay, between the epiphysis and the diaphysis, and that is called as metaphysis. Let us just try to name it, guys, first. Yes, this long part of the bone, okay, or this central part of the bone, the longest part of the bone. Yes, Khan Sahib, thank you for the comment. Yes, this long part of the bone, guys, it is called as the diaphysis. It is called as the diaphysis, right? Diaphysis is basically the longest part of the bone, right? The diaphysis, it is basically the longest part of the bone, longest part of the bone, right? And and diaphysis is also called as shaft of the bone, right? It is also called as shaft of the bone. Now, in the yellow color, the thing which I have drawn over here, this is called as the metaphysis. 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 And this is also called as the metaphysis. Now, in a long bone, okay, in a growing long bone, I would say, we have two epiphyses, two metaphyses, and one diaphysis. M say metaphysis, and remember that M, it is basically standing, the word it is M middle. So it is between the epiphysis and the diaphysis. Or I can simply say that in a very simple language that metaphysis is epiphyseal end of diaphysis, right? Okay, it is epiphyseal end of diaphysis. Okay, epiphyseal end of diaphysis, or in a very simple language, I can say that this is situated between, okay, it is situated between, yes, the epiphysis and diaphysis. Epiphysis and diaphysis, right? Now, guys, this metaphysis. Now, there is some extraordinary thing that I have drawn between the epiphysis and the metaphysis at only one end of the bone, right? Yes, I will, Shivam, I will come to all the problems, but as of now, just try to focus over here. Now, I'm coming to one of the structure that I have drawn extra over here, and that you guys need to like write over here that this structure. Now, parts of a growing long bone, this structure, it is called as the growth plate. Yes, Mohabati, very good, Mohabati. This structure, it is called as the growth plate, right? This structure, it is called as the growth plate, or this is also called as the epiphyseal plate. Epiphyseal plate, guys, right? This is also called as the epiphyseal plate. Now, guys, the growth plate, it is not. Now, initially, the growth plate is present at both the ends, guys. Over here, if you will ask me, the growth plate has already been fused. So we have only one growth plate at one end, and I will come to this point a bit later in the lecture. Okay. So yeah, I will justify this point that only at one place I have drawn the growth plate. So yes, now guys, you already know if I'm saying that the bone is growing, right? For example, if you know, now everyone knows the basic concept. Now the height increases up to a certain age. Now when we say the height increases, it automatically means that the increase in the length of the bones, right? So after 18, 20, 22, the growth stops, and that is why the growth plate or the epiphyseal plate gets fused. So that is the reason, guys. I mean, at one end, initially it is automatically fused, and later on, only one end is remaining, which is actually increasing the length of the bone. So, so that is, guys. You have to remember over here. Now, till now it is clear to everyone. Just give me a thumbs up in the chat box if the simple parts are clear to everyone over here. Just give me a thumbs up if the simple parts are clear to everyone over here. चलो फटाफट से थम्स अप दे दो जल्दी से. शिवम वेरी गुड. सारा वेरी गुड. जोरा, हीना, तन्मेश, सप्रीना, फिजियोब्लॉकी. चलो परफेक्ट. परफेक्ट गाइस. आई मीन यस. रविराज, अजाला. चलो. Now guys, let us try to discuss some more important things about this. Now epiphysis, you guys should remember two more important things over here. Now this epiphysis, yeah, this epiphysis, it is basically covered with hyaline cartilage, right? Now, now this epiphysis, it is, yes, you can just write it over here. It is covered with hyaline cartilage. Okay, it is covered with hyaline cartilage. And remember, this epiphysis, it will, now this is the part, okay, the articular end will actually, yes, form a joint, to form joint. So if I just want to draw this, the part of the epiphysis which is involved in the formation of the joint, guys, it is covered with the hyaline cartilage. Okay, this is covered with the hyaline cartilage, the ground glass cartilage, right? Yes, the hyaline cartilage, guys. Yes, the hyaline cartilage. Now, guys, remember, guys, this cartilage will never ossify. Okay, now, guys, you already know there are two ways of bone formation, right? There are two ways. One is from the cartilage, okay, intracartilaginous ossification, and one is from the membrane, right? I will be coming to the ossification also, but as of now, you guys should remember that ossification, it is basically of two types. Okay, ossification, it is basically of two types. Okay, we have, okay, the cartilaginous ossification, and we have membranous ossification. Membranous ossification. Now, guys, ossi means bone, fication means formation, right? So basically, ossification means formation of bone, formation of bone. Now, you guys already know that the bone formation, it is of two types, cartilaginous and membranous. Cartilaginous, it is basically the ossification from which the bone is formed, right? So the cartilage will form the bone, right over here. The bone is formed by two things. One is the cartilage over here, and one we have the mesenchymal membrane. One, it is the mesenchymal membrane through which the bone is formed, right? So this mesenchymal membrane I will come to when I will be discussing the embryo wala part. So there are two processes by which bone is formed. Now, all the long bones are basically formed by the cartilage. All the long bones are basically formed by the cartilage, guys. So you should remember that this hyaline cartilage, okay, it will never ossify, guys. What is so special about this cartilage is that it never ossifies because it, okay, this hyaline cartilage which is present over here at the epiphyseal end, it will never ossify, okay, to form the bone. It never ossifies, okay, and there is a layer that is called as perichondrium. And remember, this is devoid of perichondrium. This is devoid of perichondrium. There is no perichondrium, guys, over here. There is no perichondrium, guys, over here. Yes. Enchondral, dekho, endochondral or enchondral ossification. Basically, it is cartilaginous only, beta. Enchondral. Okay, enchondral. Chondro, what is for cartilage, right? enchondral intracartilaginous ossification, right? Enchondral ossification. It is one of the same things. Okay, Lillian. Right now, it is devoid of perichondrium. Very, very important. There is no perichondrium around this. There is no perichondrium around this. Right? Now, now guys, remember that yes, perichondrium is something which covers the cartilage, which covers the cartilage. Now, if you guys just want to see over here, the bone it is also covered. The bone it is also covered with a layer, okay, a fibrous layer over here, and this layer it is called as periosteum. Very, very important. And this layer it is called as the periosteum. Now, this layer it is called as periosteum. Now, when I say periosteum, osteo का मतलब क्या होता है? Bone. Peri means the periphery. The periphery of the bone I have drawn on one side, beta. It is present on other side as well. It is present on other side as well, right? Now this periosteum, it is connected to, okay, it is connected to the bone with the help of some underlying tissue, okay, with the help of a fevicol, I would say, with the help of a feviquick. It is connected to the underlying bone with the help of a connective tissue called as Sharp's fiber. Okay, this is called as the Sharp's fiber. Okay, this red color which we have drawn, it is the Sharp's fiber. Very, very important. Okay, Sharp's fiber. Now, Sharp's fibers. So basically, what is the work over here? It is the connective tissue, right? It is the connective mesenchymal. Yes. Amina, I will be coming to all the bone marrow wala part. Just wait for some time, like 4 to 3 minutes. Yeah, medical love, mesenchymal membrane से क्या क्या बनेगा? mesenchymal membrane से जितनी भी फ्लैट बोन्स होती है, एक्शियल स्केलेटन वाली जो बोन्स है हमारी, स्टर्नम हो गई, ठीक है, हमारे जो रिब्स है, स्कल बोन्स है, वो सब उससे बनते हैं, ठीक है. So yes, so it is the connective tissue. It is the connective tissue. Remember, it is the connective tissue connecting periosteum to bone. Connecting periosteum to bone. Periosteum to bone. It is the connective tissue connecting periosteum to the bone. Right? So I hope this is clear up till now, and I hope every of you have drawn this. Yes. Just give me a thumbs up, guys, if you have drawn this. Yeah. Sure. Just give me a thumbs up if you guys are drawing along with me. Now I will be, yes, drawing something more important over here. Yes. Sure. Periosteum will fuse above and down because epiphysis is fused with the hyaline cartilage. Yeah, I already told you guys na, that the periosteum, it is basically absent at the epiphyseal end. See guys, okay, Shivam, very good. One more thing that I want to specify over here. See, only that part of the bone which is actually participating in the joint formation, only their hyaline cartilage, although I have drawn it everywhere, but there is not the every part is involved in the joint formation. So automatically it fuses with the rest wala part, right? So yes. Hmm. So that is something you guys have to take in with you, right? Hmm. Now, guys, 2 3 more important things that you have to be very clear of, that yes, the diaphysis is basically, yeah. Now there has to be a difference between the hyaline cartilage which is present over here. Yeah. Now, पेरिस एक बार और बता दिया यार. चलो. Now guys, In the in the epiphyseal end, guys, in the epiphyseal end, basically we have a bone marrow which is present over here. We have a bone marrow which is present over here in the epiphyseal end, and that bone marrow, it is called as the red bone marrow, right? It is called as the red bone marrow. And over here the composition, guys, over here the composition of the bone, it is made up of spongy bone, right? It is made up of spongy bone or cancellous bone. Okay, it is made up of spongy bone or cancellous bone, right? Spongy bone or cancellous bone, right? And this spongy bone will contain, right, the red bone marrow. The red bone marrow. Very, very important. Now, can anyone tell me the function of the red bone marrow in the chat box? Can anyone tell me the function of the red bone marrow in the chat box? Whereas when we come to the shaft wala part, beta, when we come to the shaft wala part, you guys already know that the shaft is basically the longest part, and if we cut the shaft from between, if we cut the shaft from between, it is triangular in projection. Okay, let me just write it also. Most of the long bones, okay, the shaft, it is triangular in projection. Okay, if we cut, okay, it is triangular in cross section. It is triangular in cross section. Yes, yes, you guys are right. It is triangular in cross section, and you already know when I say triangular in cross section means it has three borders and three surfaces, right? Three borders and three surfaces. So every time whenever I will be discussing the long bones, I will be not telling you, right? Now let us suppose that this is the cross section. So this is border A, border B, border C, and we have three surface, guys. Surface A, surface B, and surface C. So yes, the long part of the bone, that is the shaft beta, it is basically triangular in cross section, and it has three borders and three surfaces, right? Now apart from that, guys, you all have to remember that the shaft of the, yeah, the shaft, it is basically having, or it is composed of the compact bone. Okay, the ends are spongy, and the shaft, it is formed of the compact bone over here, right? So yes, you have to be clear, the spongy and the compact bone, right? So yes, so we have this compact bone, very, very important. Yes, the compact bone. And inside the compact bone, guys, inside the compact bone, we already know we have a cavity present over here. We have a cavity present over here. And this cavity, it is called as the medullary cavity, guys. This is called as the medullary cavity. Okay. I'm just writing it over here only. The medullary cavity. Okay, you already know. Now, if we take any part, outer part is called as the cortex, and the inner part is called as the medulla. Simply, guys, over here, the outer part is the cortex wala part, which is composed of the compact bone, and the inner we have a cavity, and that is called as the medullary cavity, and that is called as the medullary cavity, guys. That is called as medullary cavity, and in the medullary cavity, okay, in the long bone, especially, we have the yellow bone marrow. We have the yellow bone marrow. We have the yellow bone marrow. In the medullary cavity, especially, we have the yellow bone marrow, right? Now, I hope this is clear to every one of you. Just give me a thumbs up, guys, if this is clear to every one of you. All the parts of the long bones, along with whatever parts we have discussed. Yes. Zara Aftab, very good. What about rest, guys? Hmm. 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 Yellow bone marrow का function क्या है? Let us now discuss about the red bone marrow and the yellow bone marrow, guys. Now, okay, someone has asked. Yes, inspire before expire. Okay, nice, nice. So let's discuss about the bone marrow in detail. Let's discuss about the bone marrow in detail. So I will be, yeah. Okay. So yes, let's now discuss about the bone marrow. The bone marrow. Now, guys, you already know that firstly, if we talk about the definition of the bone marrow, if we talk about the definition of the bone marrow, yes, I am having class daily. Tomorrow I won't have. Day after tomorrow again, it will be continuously for 3 days, right? We have 7 lectures of general anatomy, and I will be covering it. Yes. Now, remember, guys, that it is a soft connective tissue, right? It is a soft connective tissue, right? So it is a soft connective tissue. Now basically it is lying in two places, guys. It is lying in two places. Just I have shown you. Okay, one, it is the medullary cavity of the long bones. It is present in the medullary cavities of long bones. Yes, I am coming. Medullary cavity of the long bones, right? As well as the spaces, okay, between the trabeculae, between the trabeculae of cancellous bone, the cancellous bone or spongy bone, right? Basically, the spongy bone, it is basically composed of these mesh-like networks. Okay, these mesh-like networks are there, and in these pipe-like structures, there are spaces which are connecting, which are actually having these bone marrow, right? Now, guys, coming on to the types, guys, you already know that it is of two types, right? It is of two types. We have the red bone marrow, okay, and we have the yellow bone marrow. Yes, can anyone tell me the function of the red bone marrow? Can anyone tell me the function of the red bone marrow? Yes, one or two have already answered this. This is hematopoietic in nature. Now, when I say hematopoietic, guys, you already know. Yes, it will be poietic means poiesis. Poiesis means formation. Hemat means all the blood cells, right? It is capable of formation of all blood cells. It is capable of formation of, yes, Amina inspired Georgia, very good. It is capable of formation of all blood cells. Very, very important. It is capable of formation of all blood cells. Okay. Now, guys, where initially the red bone marrow, okay, it is initially the red bone marrow. Remember that it is present in the fetus, right? It is present in the fetus, and up till 2 years, it is present in the fetus till 2 years, okay? All bone marrow. Now, be very clear with the statement, guys. All bone marrow that is present entire in the whole body, the whole bone marrow, okay, it is red. It is red in color. It is red in color. Very, very important. The entire bone marrow of a newborn till the age of 2 years, the entire bone marrow, it is red in color. Yes, all, and slowly, and it is gradually replaced by, yes, it is gradually replaced by yellow bone marrow. It is gradually replaced by yellow bone marrow. Now, as you already know, after 2 years, no, the child will start having some intakes of fat will be there. So yellow bone marrow, it is mostly basically form of adipose tissue, right? It is form of adipose tissue. Now my question to you people is, after the 2 years of age, or if in an adult long bone, in which bones you will find this red bone marrow? Anyone who would like to answer this? In which bones you will find this, yes, red bone marrow? Can anyone tell me the bones in the adult? If we specifically talk about in the adults, no beta. Lalit, femur, it is in part of the appendicular skeleton, right? It is the part of the lower limb. Now, when I say the red bone marrow, it is limited only to the axial skeleton bones. Yes. Shake, no beta. Yes. Not. Axial bone mostly. Yes, the ribs mostly. So remember, it is in the adults, very important. Restricted. It is restricted to the bones of axial skeleton. Very important. Now, if I talk about myself, all the axial skeleton bones, yes, all the axial skeleton bones, yes, the sternum, right? Whatever we have discussed in the axial skeleton, right? Even the two bones that I'm talking about over here, clavicle and the scapula. Clavicle and scapula, they are the bones of the appendicular skeleton. But guys, remember, they also contain red bone marrow. Even in my clavicle also. Again, now, guys, in some books it is it is said that no, the medullary cavity is absent or this and that. But as of now, remember, the clavicle and scapula also contains the bone marrow along with all the axial skeleton bones. Shivam, I have already written axial skeleton, which automatically involves the vertebra. If you have attended my lecture yesterday, you might be knowing that axial skeleton basically is the skeleton of the midline, all the bones in the midline of the body, and vertebra is aligned along the midline of the body, right? Well, why I need to mention it alone when I've already written the axial skeleton? Anyways, so yes, I hope this is clear to everyone, right? And guys, I have already told you the cancellous end of the long bones, right? The cancellous or the spongy ends of the long bones, spongy ends of long bones, right? This is again very important. In the long bones also, if I talk about humerus, the ends of the humerus, okay, which are composed of the spongy, which are spongy in nature, or means they are composed of cancellous bones, right? They will also contain this. Yes. So axial skeleton bones, all the bones of the calvaria, the cranium, the facial part, the okay, all the sternum, the ribs, the vertebrae, everything, the clavicle, the scapula, and the cancellous and spongy ends of the long bones. Okay, the spongy ends of the long bones. Okay. So I told you, at 2 years, it is all bone marrow is red. Now, slowly and slowly, it is like depending upon the age and the weight, like, and on other some factors, it will start converting, right? Now, coming on to the yellow bone marrow. Now, coming on to the yellow bone marrow, guys. Yellow bone marrow, it is basically, yes, it is formed mostly of adipose tissue. It is formed mostly of adipose tissue, right? Now, when I say adipose tissue, it is just the fat wala part, the adipocytes, right? The adipocytes. It has no hematopoietic function, guys. It has no hematopoietic function. No hematopoietic function. No hematopoietic function. Okay. Now, guys, okay, now what is the function of the yellow bone marrow? Can anyone tell me? Now, guys, in case of severe blood loss, okay, again, a clinical point that I wanted to discuss with you people. In case of severe blood loss, in case of severe blood loss, right? Now, this tissue, okay, this connective tissue can, or it has the potential, okay, or it has the potential power of conversion to red bone marrow. Very important. Or to conversion, not to red bone marrow, conversion to active hematopoietic tissue, okay, in response to the severe blood loss. Okay, so you should remember, guys, that it has a potential power, it has a potential power, I would say, of conversion, potential power of conversion to active hematopoietic tissue, active hematopoietic tissue in response to severe, okay, in response to severe hematological stress, that is blood loss, that is blood loss. So that is again an important function of the yellow bone marrow. That is again an important function of the yellow bone marrow. I hope this bone marrow wala concept is clear to everyone. Bone, the yellow one, it is found in the medullary cavity, right? Yes. Hmm. Huh. Only on the cases of no some triggers or some stress. Chalo, just give me a thumbs up in the chat box if this is clear to you. If this is clear to you guys, right? Now, now, Mohabati, very good. Yes. Now I have to discuss something important about the periosteum as well. Okay, the periosteum. Hmm. Chalo, Sabrina, Hina, Amina, Zara, very good, guys. Now let us now discuss something about periosteum. I've not discussed about the periosteum, so yes, let us just focus on periosteum as well. Now, when I say periosteum, guys, now it is a dense fibrocellular membrane. Remember, it is a dense it is composed of fibrous tissue, okay, fibrocellular membrane, okay, which covers the outer surface of the bone, okay. So it covers the outer surface of bone. It covers the outer surface of bone. It covers the outer surface of bone. Now, if this was the definition, guys, this was the definition. Now, if we talk about the structure, guys, you already know this periosteum. It is basically composed of two layers. Can anyone tell me the name of the two layers? This periosteum, it is basically composed of two layers, guys. Right? This periosteum, it is composed of two layers. Yes. Hmm. The outer fibrous layer, the outer fibrous layer, and the inner cellular layer, the inner cellular layer. Now, guys, the periosteum which you have seen over here, the green in color. Now, this green color membrane, right, which I have drawn over here, it is distinct into two layers, right? It has outer fibrous layer and yes, inner cellular layer. Outer fibrous layer and inner cellular layer. Now, guys, outer fibrous layer. Now, when I say fibrous, guys, it automatically means that it is composed of dense fibrous tissue, right? It is composed of dense white fibrous tissue. So it is composed of dense white fibrous tissue. White fibrous tissue. Now, when I say inner cellular layer, guys, okay, inner cellular layer, it is basically composed of elastic fibers. Okay, it is composed of elastic fibers, and we have cells over here, the bone cells that is called as the osteoblast. Osteo means bone, and we have the cells of the bone that is the osteoblast. Okay, and remember, guys, the inner cellular layer, it is a very rich, or I can say it is having a rich vascularity. Okay, so over here, basically, the blood supply plus the nerve supply is present, right? The blood supply and the nerve supply, it is present, richly supplied with the blood and nerve supply, right? Right. Now, I hope this is clear. See, I'm not discussing this right now, and yeah, I will come to all these topics, but let me finish with the basic anatomy right now. I'm teaching periosteum. Some of you are so, yes, osteoblast. I will be coming on to the composition of the bone cells. You just need to wait right now. Yes. Osteoblasts are basically the bone forming cells, and osteoclasts are the cells which help in the resorption of the bone amina, okay, which are helpful in engulfment of the dead bone tissues and cells, right? So, yes, apart from that, guys, you should remember the function as well. So, the basic function of the periosteum, it is actually the attachments of bones and the muscles, right? It is attachment of muscles, okay, plus the bones, oh sorry, muscles and tendons, sorry, muscles, tendons, ligaments, all that, right? Okay. Now, even it has a nutritive function to the cortex. You already know under to the periosteum we have the cortex part of the shaft, right? Then we have medulla. बाहर वाला पार्ट क्या होता है cortex और inner वाला पार्ट क्या होता है medulla और उसी के बाहर क्या present है periosteum. So periosteum also has a nutritive function. Okay, it also has a nutritive function to the cortex of the bone, okay, to the cortex of the shaft, okay, or to the cortex of the bone, right? Okay. Even guys, one more important clinical part that I want to tell you, even in cases of fractures or in cases of what we say disease of the bones, right? So it is an essential part. Okay, it's osteogenic activity. You already know it contains the osteoblast, guys. Okay, it contains the osteoblast. Very important. So this osteoblast or osteogenic activity. Okay, remember the osteogenic activity, the osteogenic activity is basically essential, right? Essential for healing part, right? Healing part of the fractured bone, okay? Or if there is any disease of the bone, right? If there is any disease of the bone, again, an important concept over here, right? So that is guys, you have to remember over here. So that was about that was about the, yeah, what we say, the parts of the long bones, the parts of the long bones, right? So yes. So just give me a thumbs up, guys, if it is clear. See, Amina, if you have so many questions, please connect to my Instagram. I will be answering that. But continuously asking questions which are not a part of it won't help in the running lecture. Now, these are the different parts. I've already told you the proximal epiphysis, the metaphysis we have, the diaphysis we have. Hina, Koster, very good. Sabrina, perfect. Perfect, Peter. The metaphysis again and the distal epiphysis, right? The part which is participating in the joint formation, it is formed as articular cartilage or the hyaline cartilage, one of the same things, right? The ends are basically composed of the spongy bone, okay? Whereas the medullary or shaft, it is the compact bone, right? So, yes. Now coming on to the next wala part. Yes. Now, now guys, I want to explain one thing over here. I want to explain one thing, but okay, let me just first teach you the next topic, that is the types of the epiphysis. That is the types of the epiphysis. Sanju, yeah, okay, not an issue, Sanju. Just try to be along with me. Yes. Hmm. Now, I have to teach the growing ends of the long bones, but before that, yes. First, let us learn about the types of epiphysis. Then I will be coming on to the growing ends of the long bones. Now, the very first one over here, it is the pressure epiphysis. The pressure epiphysis. The pressure epiphysis, guys. Now, remember, guys, that it is the part of the bone. It is the part of the bone that is involved in joint formation. That is involved in joint formation. That is involved in joint formation. Now, when I say part of the bone that is involved in joint formation, it clearly means that I'm talking about the articular part. The articular part. Okay. Articular means the one which will be joining with the other bone to form the joint, right? And this part it is covered with the hyaline cartilage or the articular cartilage. It is one of the same things, right? Articular cartilage or the hyaline cartilage, it is one of the same things, guys, right? Now, the pressure epiphysis. Now, guys, try to listen everyone over here. Now, suppose this is a bottle, right? Everyone can see this particular bottle. Okay, I'm not promoting any bottle brands over here, but yeah, of course, this bottle. Now, suppose this bottle is kept like that, this, and I am trying to pick this bottle with the help of my hand. With the help of my hand. Now, all the weight from the hand will come to the forearm, will come to the arm, and from the arm all the weight will be transferred to the midline of the body. It will be transferred to the midline of the body. So this is how the weight transmission takes place, right? All the weight carried out by the limbs, it is transferred from the limbs or from the appendicular skeleton to the axial skeleton, to the midline bones, right? Now, guys, this something requires a lot of so that pressure or that weight is basically transferred with the help of these bones only. And which part of the bone basically helps in transmission of this pressure? So that is the head. Okay, that is the head part of the epiphysis. And remember the examples over here, guys. The examples over here, very very important. We have the head of the humerus. Please write down this, then I will explain. Head of the humerus. We have the head of the femur. Yes, the head of the femur bone. Now, can anyone tell me the humerus bone? It is present in which limb? It is present in which region? And also for the femur, it is present in which region? And it is a part of which limb, guys? Right? I just want to know. Yes, yes, Raviraj, you are right. Just let me know, guys, if you know this. Chal. Sabrina Mohabbati, it is present in the upper limb and arm. Ravi Raj, yes, the head of the femur, it is right. Zara, ठीक है. Arm region, upper limb, humerus. Hino Kausar, yes. Upper limb वाला part है, but the arm वाला part, axial. Lower limb thigh. Sabrina, very good, guys. Yes, Jora, yes, upper limb and arm. What about rest, guys? चल, हाँ, ठीक है. चलो, Hino Kausar, very good. Femur, it is the lower limb वाला part. Now, again, there are two things that I have to tell over here. We have the condyles of, yeah, the tibia. Condyles of the tibia. Condyles of the tibia. Yes, George Azala, very good. The lower limb, it is the femur. The condyles of the tibia. Now, guys, just try to see over here in this particular picture. Okay, this particular picture. Now, this is the humerus bone. This is the humerus bone. And this is the anterior part, okay, or I can say the anterior view. You are watching the humerus from front. Now this is the humerus from the shoulder joint to the elbow joint. This is the arm region, and in this arm region the humerus bone is present, which is forming the shoulder joint above and the elbow joint below. Now the joint which is forming above, this hemispherical structure, I would say, rather, this hemispherical structure, if you just focus over here, guys, this hemispherical structure, it is called as the head of the humerus. It is called as, yes, the head of the humerus. The head of the humerus. Now you guys already know when I say head of the humerus. Now it is hemispherical in structure. Hemispherical in structure, it means it is half half of a sphere. Everyone has seen a Costco ball, right? The playing any ball. If you cut a ball, right, and how the half see the ball, it is in the form of a sphere, right? If you cut it, then it will become hemisphere. So this hemispherical structure over here, which you can see over here, this is the head of the humerus. This is the head of the humerus. Now this head of the humerus, it is forming a joint with the glenoid cavity of the scapula. Now scapula has a cavity. If you just want to see over here, you guys can see that this is a triangular bone and this is called as the scapula, guys. This is called as the scapula, right? This is called as the scapula. So this is called as the glenoid. Be very clear with the terms, guys. I would be coming to all the anatomical terms: process, tuberosity, okay, trochanter, tubercles, spine, ankles, everything. No need to worry. Just as of now, remember, this is called as the glenoid cavity of scapula. Now, this is the glenoid cavity of the scapula and this is the head of the humerus. So together they are forming which type of joint, guys? This is very basic and I want everyone to answer this. They are forming which type of joint? There is a ball, the hemispherical wala part, and there is a yeah, cavity. So I just want to know, guys, if you can just pick it from this particular term. Yes, Johra, very good. It is the ball and socket joint. What about rest? Hmm. Yes, Sabrina, very good. It is ball. Zara, very good. Yes, yes. The glenohumeral joint or the ball and socket joint, the type medical love, it is the ball and socket joint. So you already know that it will transfer all the way to the scapula. Now from the scapula, it will go to the clavicle. Okay, we have the acromioclavicular joint. Okay, acromion process. This is the acromion process. I will be coming to all the terms, guys. No need to worry. Okay, so as of now, just remember we have the head of the humerus and guys, this is the femur bone which is present in the thigh region. Thigh region का hip joint से लेके that is up till the knee joint, right? The longest bone, the thigh region. This is the femur bone, and femur bone, that this part it is called as the head. This part, this rounded structure, it is called as the head. Now, can anyone tell me the femur bone will form which joint? Okay, which joint? It will articulate with which bone? It also forms ball and socket joint. It articulates with which bone, guys? Which bone of the body? Okay, just name of the bone, guys. I've already taken the name. Yes, Amina, very good, beta. It is the hip bone, right? It is the hip bone. And what is the part of the hip bone which is participating? That is the acetabulum. That is the acetabulum. Be very much clear with the term acetabulum. Yes, it is the hip bone. Sabrina, Jora, Hina, Zara, medical love, Senika, Burman. Very good. Very good, guys. It is also a type of ball and socket joint. So you can see that all the pressure from the extremities, it is carrying up to the axial skeleton bones with the help of these parts. So these parts are actually holding all the pressure. So that's why these are called as the pressure epiphyses. These are the parts of the epiphyseal ends, right? So that is guys, you have to remember even the condyles of the tibia. Now when I say condyles, guys, condyle simply means the expanded portion of the bone, right? Yes. The expanded portion of the bones, expanded ends of the bone, expanded ends of the bone, or I would simply say the rounded expanded ends of the bones. It's just like this, the condyles. Okay, so this is the condyle. Okay, the rounded expanded parts of the bone. It is called as the condyles. So tibia, it is present in which region, guys? And you guys are going to tell me whether it is which it is medial or lateral bone of that particular region. So you guys are going to tell me. Just revise the previous lectures and please answer it. Not beta pectoral, chest region होती है beta. Pectoral is the chest region, tibia chest में नहीं होता. हाँ Sabrina Mohabbati, very good. It is the leg region, guys, and it is the medial or lateral part of the leg. Hina, it is the lower limb. Yes, medical love. It is the medial leg of the, sorry, medial bone of the leg. Yes, it is the medial bone of the leg. So that is about the pressure epiphysis, where the part of the bone it is involved in joint formation, right? So that is about all that you can see over here, right? So yes. Now coming on to the next wala part, the next epiphysis, that is the traction epiphysis, guys. That is the traction epiphysis. That is the traction epiphysis. Now, the traction epiphysis, unlike the pressure epiphysis, it is not forming any joint. Okay, it is non-articular. Okay, it is the part of the bone. It is part of the bone that is non-articular. That is non-articular, right? It is part of the bone that is non-articular, which is not forming any kind of joint, right? Non-articular. Okay, and remember, it is located closer to pressure epiphysis. It is located closer to the pressure epiphysis, and guys, it develops as a result of pull by a tendon or ligament. Tendon or ligament. Now guys, see. Now this traction epiphysis, it is not forming any joint, guys. Secondly, it is located very much closer to the pressure wala part of the bone. I mean, to very much closer to the head of the humerus, very much closer to the head of the femur, right? And secondly, it is actually formed due to a pull by a tendon. Now, for example, let me just pen down all the examples, and then we will discuss it one by one. So we have the lesser tubercle of humerus, lesser tubercle of humerus. Please write down. I know it might be difficult for you as of now since you're learning it for the very first time, guys. I will be teaching all the terms, what is meant by tubercle, everything. So as of now, just first write down. I have a separate class for all the bony markings. I will be teaching you every anatomical term which is used for markings of the bone. So absolutely no need to worry. So we have the greater tubercle of the humerus, the greater tubercle of humerus. We have lesser trochanter of femur, lesser trochanter of femur. We have greater trochanter of femur, greater trochanter of femur. Now we have two in the humerus part and two in the femur wala part. Two in the femur wala part. Now guys, just try to see over here. I will sutures I will be discussing tomorrow, Amina, in the not tomorrow, day after tomorrow in the joint section. So now guys, just try to see near to the head of the humerus. If you can see the head of the humerus, near to the head of the humerus, now these are certain round-like projections. This is called as the lesser tubercle of the humerus. Lesser tubercle of humerus. Now, when I say humerus, guys, okay, that is the bone of the arm region. But tubercle का मतलब क्या होता है? What is meant by the term tubercle? Tubercle is nothing but a small rounded projection of the bone. I'm teaching you right now. Please learn any rounded projection. You will find the term tubercle in many bones, right? In many bones, you will find it. Okay. So you will find it in no scapula also, supraglenoid tubercle, infraglenoid tubercle. Now, when I say tubercle, guys, you have to be yes, you have to be very much clear with the fact. Okay, I don't know what has happened. Just a moment, guys. I don't know what they have done. Hmm. Chal. Ah, now, small rounded projection. Now, guys, when I say bony projection, that is the processes. Processes are, देखो एक term होता है process और एक होता है tubercle. Processes are basically slightly longer than the tubercle, right? Tubercles are very small rounded projections of the bone, very small rounded projections of the bone, right? Amina, if you haven't seen my previous lectures, please go through it. I'm not teaching radius and ulna over here. I have already taught it. Okay, thumb side, pe obviously we have the radius part, and on the little finger side, the medial bone of the forearm, that is the ulna. Come on. I don't know why I'm answering to all these questions right now. Now, please don't waste time. If you have any particular doubts other than this topic, please connect to me. Now, this is called as the greater tubercle of the humerus. This is called as the greater tubercle of the humerus. Greater tubercle of humerus. Now, on these parts, beta, on the lesser tubercle and on the greater tubercle, guys, we have the insertion of muscles. Okay. On the lesser tubercle, we have subscapularis muscle. I will be coming to all that. I will be teaching you the bone in detail. But as of remember, what is lesser tubercle, what is greater tubercle, you must know, you have to see this. Okay. So this is which bone? Humerus. In the humerus, near to the head, near to the pressure wala part, we have the traction epiphysis. Now, coming on to the next part, that is the next example that I have made in front of you, that is the lesser trochanter of femur and greater trochanter of femur. Now you already know the femur, it is present in the thigh region, right? It is the longest and strongest bone of the body and it is present in the thigh region. Now near to the head part, you can see an irregular blunt area, right? An irregular blunt area, okay? An area which is larger than the tubercle. An area which is larger than the tubercle, it is called as trochanter. It is called as trochanter. It is called as the greater trochanter of the female, sorry, of the femur. And guys, we have the lesser trochanter of the femur. Lesser trochanter of the femur. And guys, this time they have asked a question in the exam, and you guys are going to this as homework. Which muscle is attaching over here? Although I will be teaching this in detail. Yes, I will be teaching this in detail. But remember that this question they have asked, they have given a picture and they have simply asked which muscle is attached over here. So obviously, guys, you should know that ट्रोकैंटर और ट्यूबरकल में फर्क क्या होता है ट्यूबरकल इज एक्चुअली it is a very small projection, right? A small rounded projection, whereas when we talk about trochanter is a large irregular blunt area, right? It is also for these muscles, tendons and ligaments, but remember guys, it is a large irregular blunt area as compared to the tubercle. So I hope this is clear to each one of you. The second one wala part, that is the yes, the traction epiphysis. And I hope you understand the difference between the tubercle and the trochanter, right? What is the head? What is tubercle? What is trochanter? As of now, there should be something in your mind. Just give me a thumbs up, guys, in the chat box if this is done. If this is done. Just give me a thumbs up, right? Sure. Hmm. Now, Miracle Love, Darmani, Hina, Sabrina. Sure. Perfect, guys. Now, coming on to the next epiphysis, that is called as the atavistic epiphysis. The next epiphysis, that is called as the atavistic epiphysis. Atavistic epiphysis. These are very important questions, beta. They are always asking in the exam, right? The atavistic epiphysis. Let me not highlight this. Yeah, atavistic epiphysis. Now, You guys should know that in humans, we have a remnant of these bones. For example, now, phylogenetically, these remnants are present in us. Okay. So remember that phylogenetically or during the course of the evolution, these bones, okay, are present in us, okay, are present in humans, right? Earlier guys, remember earlier guys, no, these humans, okay, earlier it was present in like four-legged animals. For example, the cats, the dogs. Let me just highlight an example for you right now. Yes, we have the coracoid process of scapula. Coracoid process of scapula. Now, you guys already know that the scapula, it is the bone of the upper limb, right? The pectoral girdle wala part. It forms the shoulder joint wala part, right? Scapula, it is a shoulder blade. If you can just see over here, guys, if you can just see over here, it is a triangular flat bone, right? It is a triangular flat bone, and this triangular flat bone, it is located on the posterior. ये पीछे की तरफ होता है, posterior की तरफ, पीछे की तरफ होता है. Scapula दो होते हैं, flat bone होती है. ये सब basic चीजें हम लोग को पता है. Now this scapula, it is having a process. Now be very clear with the term when I say process, guys. Process देखने को मिलता है यहाँ पे, and this is called as the coracoid process of scapula. Coracoid, this finger, bent finger like structure. Now what is meant by process? सबसे पहली बात process का मतलब समझो. Process का मतलब होता है bony projection. Bony projection. Bony projections. For example, ये आपकी पूरी की पूरी body, you have your own whole body right now over here, and this upper limb is coming out of this body. So this upper limb is coming out. Okay, it is projecting out of your own from the major part of the body, right? Similarly, the scapula also has the major part of the body, major surface area of the body is there, and some part of the bone it is projecting out, and some part of the bone it is projecting out. Now guys, you will say sir, tubercle bhi to hai, small rounded projection. That's the difference, guys. Now when I say tubercle, guys, when I say tubercle, when I say tubercle, it is small rounded projection. Okay, it is small rounded projection. It is small rounded projection. Now when I say process, guys, process, it is bony projection, and this projection, it is usually larger than the tubercle. Tubercle is a very short projection, but जब हम process की बात करते हैं तो process वो part है bone का, that part, it is very much bigger than the tubercle. It is very much bigger than the yes, it is coming out. Obviously part बड़ा है तो बाहर तो आएगा ही. Okay, it is coming out. So it is the coracoid process of scapula. बेटा ये जो animals होते हैं, we have some animals like cats and dogs. Earlier they used to know be a part of this coracoid bone was a part of these animals, but now they are found in humans, and they are fused with the scapula. They are fused with the scapula. Is that clear? Is that clear, guys? So atavistic means we have the remnant of these bones, like it is present in us. Earlier it was found in the four-legged animals like cats and dogs, right? So I hope this is clear to each one of you. Sure. Sure. Now, sure. इतना क्लियर हो गया सब लोगों को? इतना क्लियर है? We have already discussed the atavistic epiphysis. Again, one more example that I want to discuss with you. One more example that I wanted to discuss with you. Yes, the second example, it is the ostrigonum. Ostrigonum. Now, os is basically referred to as the bone, and trigonum basically means, yes, or simply I can say the posterior tubercle of the talus. Posterior tubercle of the talus. Now guys, you are going to tell me what is talus. Talus is a bone which is found in which anatomical region of the body? आई हैव ऑलरेडी डिस्कस दिस यस्टरडे। टैलस जो है कहाँ पे सुना है? चल फटाफट से बताओ। इफ यू नो गाइस प्लीज कमेंट इन द चैट बॉक्स। इफ यू नो गाइस प्लीज टेल मी वेयर वी हैव स्टडीड टैलस। लोअर लिम्ब बोन ऑफ फुट, यस सेनिका सब्रीना, यस फुट 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 का कौन सा वाला पार्ट है? फुट का कौन सा वाला पार्ट है? वी हैव थ्री पार्ट्स, फुट बोन्स आर बेसिकली हैविंग थ्री पार्ट्स। यस वी हैव tarsal, metatarsals and phalanges. Tarsals, metatarsals and phalanges. You guys are going to, yes, yes, part of the tarsal bone, yes, part of the tarsal bone, yes guys, you're right, you all are right, yes, the seven bones, the tarsal bones, and we have the talus. Now when I say tubercle, tubercle का मतलब सबको पता है, it is a small rounded projection, small rounded projection, and posterior means it is located on the posterior side, पीछे की तरफ होता है। टैलस बोन जो होती है उसके पीछे की तरफ ये स्मॉल राउंडेड प्रोजेक्शन दिखता है। So that is basically ostrigonum. That is a part of the atavistic epiphysis. It was earlier found in the animals. So yes, you should know that is the talus bone over here. That is the talus bone, and you can very well see the small rounded projection that is called as the tubercle beta. And this tubercle is located पीछे की तरफ posterior side. So that is the posterior tubercle of talus or os trigonum. I hope this is clear to everyone. Yes, I hope this is clear to everyone. Now coming on to the next wala part, the next epiphysis, the next epiphysis, that is the aberrant epiphysis, guys. That is the aberrant epiphysis. The aberrant epiphysis. The aberrant epiphysis. Now aberrant epiphysis is something which is not normally present. Okay, so remember, it is not normally present. ओके, एबरेंट, गेस्ट, जैसे आप लोग के घर गेस्ट आ जाते हैं, बिल्कुल है। एबनॉर्मल, अनयूजुअल, गेस्ट अपीयरेंसेस, राइट? सो दैट इज अनयूजुअली प्रेजेंट। नाउ गाइस, what I have to teach you over here. So yes, example, write down. Example is important. That is head of first metacarpal and base of other metacarpals, base of other metacarpals, base of other metacarpals. Yes, Buaji, base of other metacarpals. Now guys, you already know. Let us first know what is a metacarpal. Let me just explain to you guys. You already know a metacarpal has three parts. A metacarpal has three parts: head, shaft, and base. A metacarpal has head, shaft, and base. Now, guys, this epiphysis will be developing at the head wala part, right? This epiphysis will be developing at the head wala part. Unusual. It is not normally present. Again, guys, I'm telling you, this epiphysis will develop aberrantly, unusual. In some part of the population, it is present. Head of the first metacarpal, whereas when we have the base wala part, right? So there is an epiphysis coming on the second, third, fourth, fifth. So we have all the four one. Basically, the epiphyses are developing at the base of the second, third, and fourth, fifth metacarpals. Okay, second, third, fourth, fifth. Usually, guys, this epiphysis is not present in a normal human being. Aberrant का मतलब ही क्या होता है? Unusual. So this epiphysis develops at the head of first metacarpal. Head के ऊपर एक epiphysis develop कर जाएगा, पहले metacarpal के ऊपर, और सेकंड, थर्ड, फोर्थ, फिफ्थ मेटाकार्पल के बेस के नीचे डेवलप कर जाएगा, बेस के नीचे डेवलप कर जाएगा. सो दैट इज समथिंग कॉल्ड एज एबरेंट एपिफाइसिस. यस yes Abhishek KG, you can obviously watch this. Basic anatomy सबको आनी चाहिए. Even in the physiotherapy you should know the basic anatomy, right? और मैं तो कहता हूँ पूरी anatomy आनी चाहिए. तो सीख लोगे तो कुछ जितने कंसेप्ट क्लियर रहेंगे उतना ज्यादा आप प्रोग्रेस करते हो, राइट? So yes, even I'm learning till date. So you guys who are just starting with. So yes. So I hope all the epiphyses are clear to every one of you. I hope all the epiphyses are clear to every one of you. Just give me a thumbs up, guys, in the chat box. Yes. चलो समझ आ गया सब लोगों को. Medical love, if you continue to attend the lectures and if you will share my videos, if you will leave lovely comments in the chat box, definitely I will complete. If you will give me strength to complete all this, I will definitely complete. I have taken initiative of completing one module, that is the general anatomy, and I have included 7 lectures, right? This is the 4th lecture today, and by this month, by the end of this month, all the 7 lectures will be completed. So yes, so yeah, I just want you to share the video with many of your friends. Yes, and yes, so that is about the types of the epiphyses, guys, right? So yes, that is the metacarpals. This is the first metacarpal, second, third, fourth, and fifth. So at the head of the first metacarpal and at the base of the all the 4 metacarpals, right? So that is something you guys have to remember. Now, coming on to yeah, coming on to the next topic, that is the blood supply of the long bones. Coming on to the next topic, that is the blood supply of the long bones. Now, blood supply of the long bones. Let us just try to see the blood supply of the long bones with the help of a diagram, guys. Right now, you guys already know that. Store it. Hmm. Now let us suppose that this is the end of the long bone, that is the epiphysis. Then we have our lovely growth plate or the epiphyseal cartilage. Below that, guys, you already know we have this, yes, the metaphysis and the diaphysis wala part. So yes, just try to be along with me, right? And इसको थोड़ा सा इसका figure ठीक कर लो. Hmm. Try to draw it wider. Figure, yeah, I will be doing, guys. If you will continue to know, attend the lecture, if you guys will, again, it's on you people. If you will show the response code, I will be doing all the topics nicely, right? So please ask your group mates, batch mates, share the videos, leave your feedbacks. Okay. Now, guys, this is the long bone. This is the long bone, right? Now, you guys already know that this is the epiphysis. Let me just write down. This is the epiphysis. This is the growth plate. Growth plate or the epiphyseal cartilage. Epiphyseal cartilage, right? Or the epiphyseal plate. Basically, write down like this. Epiphyseal plate, right? Now, over here, you guys already know that we have the, yes, the metaphysis, right? The metaphysis which I have drawn in the yellow color. The metaphysis. The long part that is called as the diaphysis. Diaphysis or the shaft of the bone. The shaft of the bone. And this is again the metaphysis, and we have the epiphysis. Metaphysis, epiphysis. I will come to the point why I have drawn growth plate at only one end. I will be writing the concept after it. Yes. Now, guys, remember that in the diaphysis, guys, in the diaphysis, remember the major artery that is supplying the bone. the major artery that is supplying the bone. Yes, we have a hole in the diaphysis, and oblique foramen is present, and this foramen, it is called as the nutrient foramen. It is called as the nutrient foramen. Now, when I say foramen, guys, foramen basically means a hole, right? A hole in the diaphysis, an oblique hole, which you will see over here, foramen. Now, why the name nutrient? Because an artery, it is coming inside, okay? It is coming inside, and this artery, it is called as the nutrient artery. Yes, this artery, let me just write down over here. I'm just writing it over here. This is the nutrient artery, right? This is the nutrient artery which is coming through this foramen, and it is entering inside the bone. It is entering inside the bone. Now, guys, this nutrient artery will go above and will go below, right? It will give two branches, ascending branch. Ascending means it is going above in a long bone, and down basically means descending branch. So we have two branches bit over here. So this is, yes, the descending branch of the nutrient artery, and this is the ascending branch of nutrient artery. Ascending branch of nutrient artery. Ascending branch of the nutrient artery, guys. Please see the lectures from beginning. I would suggest, and be with me, guys. Do attend the sessions with me, because anyways it's going to help you a lot in future. I'm telling you, if you know the basics, you will definitely anatomy रट्टा नहीं लगाना पड़ेगा, निमोनिक्स पे ज्यादा कंसंट्रेट नहीं करना पड़ेगा, ठीक है? निमोनिक्स नहीं याद करने पड़ेंगे. कितने निमोनिक्स याद कर लोगे? कंसेप्ट इज समथिंग दैट यू हैव टू नो, गाइस. बेसिक से पढ़ोगे ना, मतलब छोटे छोटे टर्म्स का मीनिंग समझोगे, इसका मतलब क्या होता है, ये कैसे है, क्या है, मीडियल क्या है, लेटरल क्या है, ये सब चीजें आती है ना, पोस्टीरियर, मतलब चीजें क्लियर होती है. अभी जैसे मैंने ट्यूबरकल बताया, ट्रोकैंटर बताया, प्रोसेस बताया, अभी तक तुम लोग सिर्फ रट रहे थे. यू शुड एक्चुअली नो द मीनिंग ऑफ दिस, राइट? दैट इज वेरी मच इंपॉर्टेंट, गाइस. नाउ इट इज, आप कोई भी चीज रट्टा नहीं लगा सकते. कितना रट्टा लगाओगे यार? पूरी चार रट के क्या मतलब, भूल जाओगे ना फिर. कंसेप्ट समझना बहुत जरूरी है चीजों को लेकर. So yes, we have the descending branch of the nutrient artery, right? We have the descending branch of the nutrient artery. Now, this artery will make folds over here, right? This artery will make folds over here at the ends, right? Now, while going up and down, they will give lateral branches. They will give lateral branches, guys. They will give lateral branches. Very, very important. They will give lateral branches. Yes. Now this red wala part, these are nothing but the lateral branches, right? The lateral branches of the nutrient artery. Okay, these are the lateral branches of the nutrient artery. Now, guys, we have something. Yes, we have something called as the metaphyseal arteries. Okay. Now, some metaphyseal arteries internally they are coming from this what we say the nutrient artery. Okay, the metaphyseal arteries. Some arteries they are coming from the, yes, yes, they are branches of this nutrient artery. But some metaphyseal artery they are also coming from outside. They are also coming from outside, right? They are the branches of muscular artery. Okay, outside कहाँ से आ रही? Muscular artery की branches है. But inside कहाँ से आ रही? It is coming from this nutrient artery only. So we have this metaphyseal arteries. So remember, yes, We have this metaphyseal arteries, metaphyseal arteries, metaphyseal arteries, right? And in the epiphysis, guys, you should know we have the epiphyseal arteries, right? We have the epiphyseal arteries. So yes, you have to know we have the epiphyseal arteries. You can just draw it over here also, the epiphyseal arteries. Okay, epiphyseal arteries. Right, we have the epiphyseal arteries. Apart from that, guys, you have to know the growth plate. Okay, we have already learned that some arteries of the metaphysis are coming from the nutrient artery and some are coming from outside, which are branches of the muscular artery. So these are the metaphyseal arteries. These are the metaphyseal arteries. Now the growth plate or the epiphyseal plate, the growth plate or the epiphyseal plate, they are basically receiving, right? They are receiving. See, the epiphyseal plate or the growth plate, guys. See, the growth plate, it is a cartilage. Now, you have to understand the concept over here. The epiphyseal plate, it is a cartilage. Okay, and which cartilage? Hyaline cartilage. It simply means that there is no blood supply, no blood supply of its own. Okay, no blood supply of its own. It receives blood. Okay, it receives blood. It receives blood from metaphyseal and epiphyseal arteries. It receives blood from metaphyseal and epiphyseal arteries. It receives blood from the metaphyseal and epiphyseal arteries. So remember, guys, they will again receive the blood from the epiphysis, okay, from the epiphysis, and it will again receive the blood from the metaphysis also, क्योंकि खुद की blood supply absent है, खुद की blood supply absent है, so it is receiving the blood from both the ways, from the epiphysis also and from the metaphysis also, from the epiphysis and from the metaphysis. So yes, apart from that, guys, apart from that, you already know this green color structure that I'm drawing over here, that is called as the periosteum, right? This is the periosteum. This is the periosteum. Now, you already know we have some arteries which are supplying the periosteum, and these arteries are also supplying to some parts of the what we say, the compact bone, right? The compact bone. So we have this, yes, we have this periosteal arteries. We have this periosteal arteries, multiple periosteal arteries which are coming from outside. They are supplying the periosteum. Periosteum has two layers, the fibrous and the cellular layer, and along with a small portion of the compact bone, that is the outer part of the compact bone, right? So the periosteal arteries, basically they are supplying outer one third of compact bone, outer one third of compact bone. They are supplying outer one third of the compact bone. Now, if I ask you the inner two third, अगर बाहर का outer one third compact bone का periosteal artery supply कर रही है, the inner two third will be supplied by which bone, guys? The inner two third will be supplied by which bone? Tell me, guys. Come on. The inner two third will be supplied by which bone? I mean, which artery? Sorry. Outer one third, it is periosteal. Inner two third, it is supplied by which? कौन सी branches? These small branches, guys. These small branches which you can see on the screen. Yes, the lateral branches of the nutrient artery. Mohabati, very good. The lateral branches of the nutrient artery. The lateral branches of the nutrient artery. Okay, the lateral branches of the nutrient artery. So remember, guys, you have already written this. Let us just pen down some important points over here. Yes. So now put the heading as the vascular supply of the bones. Vascular supply of the bones. In short, we will write all the important points over here that we have discussed. Now, the very first one that we have to discuss, it is the arterial supply. The arterial supply. Now, in the arterial supply, guys, arterial supply of long bones. So, yes, vascular supply of long bones we are discussing. The very first artery that you have to remember, it is the nutrient artery. Let me follow the color code. Yes, it is the nutrient artery, guys. It is the nutrient artery, right? Now, it is a large artery, right? You already know it is a large artery. It enters the shaft of the bone, enters shaft of bone through which foramen? Via nutrient foramen. Very, very important. Via nutrient foramen. Okay, via nutrient foramen, right? And this nutrient foramen, where it is present in the middle of the shaft. It is present in the middle of the shaft. बिल्कुल shaft के बीचों बीच देखने को मिलता है. That is present in the middle of the shaft. Okay. Now it reaches the medullary cavity. This okay, let me just write down like this. So this nutrient artery, okay, nutrient artery reaches medullary cavity, reaches the medullary cavity, where it divides into which two branches, guys? Where it divides into, and then divides into, yes, the ascending and descending branches correspondingly, right? And divides into ascending and descending branches correspondingly, right? Ascending going up, okay, going up, and descending means going to the lower, okay. So upper and the lower metaphysis वाला part तक जाता है, ठीक है. Now coming on to the next artery, we already know we have the epiphyseal arteries. Very, very important. You already know the epiphyseal arteries over here. The epiphyseal arteries, right? The epiphyseal arteries are they enter the epiphysis, right? Supplying the outer shell, right? As well as you already know the inner part it is actually of spongy bone, and outer it is very thin layer of compact bone. So we have the epiphyseal artery, then we have metaphyseal arteries, right? Metaphyseal arteries, metaphyseal arteries are there, right? Now metaphyseal arteries, basically they are what we say. Now they will supply metaphysis, obviously they will supply metaphysis, and they are coming from two places, guys. They are coming from two places, right? They are derived from, if you will ask me, they are derived from internally. अंदर वाले metaphysis कहाँ से आ रहे? Nutrient artery से, ठीक है. Internally they are derived from nutrient artery, and externally they are branches of muscular artery, right? Outside the bone we have the muscles, and muscles are supplied by the muscular arteries, and yes, we have the external branches coming from the, yeah, muscular artery wala part. Okay, now now guys, in children, very, very important, this point I have to like write it down, and then I will come to this. Now in children, very, very important, the clinical part. Have you heard the term of osteomyelitis, guys? Can anyone tell me what is meant by the term osteomyelitis? In children, before ossification, before ossification. Okay, meanwhile, you guys comment in the chat box what is, yes, the clinical part. In children, before ossification of, yes, the epiphyseal cartilage or the growth cartilage, epiphyseal cartilage or growth cartilage, epiphyseal cartilage or the growth cartilage, guys. in children before ossification of the epiphyseal cartilage or the growth cartilage, the metaphyseal arteries are end arteries. Obviously beta खुद दिमाग लगाओ ना. You just saw the diagram, inflammation of the bone. Which part of the bone? Okay, George, you are going to tell me which part of the bone. Hmm. Now again you guys can see that this metaphyseal, this nutrient artery, it is going up till metaphysis and then it is serving, because it cannot go up till the epiphysis, right? Because there is a growth plate in between, so these are end arteries मतलब ये वहीं पे खत्म हो जाती है. Children में we have the growth plate, right? We have the growth plate as compared to the adults. The children have growth plate. Now, due to the presence of the growth plate, guys, this metaphyseal arteries cannot go to the epiphysis, right? They have to limit up till there, and these are the end arteries. मतलब वहीं पे खत्म हो जाती है metaphysis तक ही. So remember guys, the infection is very very much common over there. ठीक है? So yes, that is infection is very very common over here. That is called as the bone infections are very very common because the blood supply, due to the rich blood supply, you know, all due to the blood supply, all the bacteria are gathered over there, right? And they form a hairpin loop like structure where all the bacteria are no जकड़ के रख लेते हैं. Okay, they are actually yeah. So that is the bone infection. Okay, that is the bone infection, and that is something that we have to remember, that is osteomyelitis. Okay guys, itis का मतलब होता है inflammation of the bone, the bacterial infection of the bone, inflammation. Osteo means bone. My means metaphysis, guys. Metaphysis. Which part of the bone is prone to infection? In children, it is the metaphysis because they have the end arteries. Now, as compared to the adults, in adults, this osteomyelitis is not seen as of. Why? Because beta, in adults, after ossification, if the ossification is already done, after ossification of this epiphyseal cartilage, okay, they anastomose with epiphyseal arteries. They anastomose with epiphyseal arteries. They anastomose with epiphyseal arteries, guys. Right? Now, when I say they anastomose, you have to be very clear with this term, guys. Now, let us just suppose that this is the epiphysis and the growth plate is already fused with the epiphysis. Now we already have epiphysis and metaphysis. So the arteries will be going to the epiphysis and epiphyseal arteries will also be there. Anastomose का मतलब होता है whenever the two arteries are meeting or two or more arteries are meeting so that the blood can go from one direction to another or vice versa. Anastomose का मतलब ही क्या होता है? Meeting point of two or more arteries where there could be exchange of the blood. So that is something which is in adults, after ossification, the growth plate, the cartilage is already converted into bone. So automatically the epiphysis is merged with the metaphysis. So the arteries also, they come in contact with each other and the blood circulation is more, right, as compared to the children where the metaphyseal arteries are ending. So they will have more bacteria placed over there, so more chances of infection. So I hope this concept is clear to everyone. I hope this concept is clear to everyone, guys. Just give me a thumbs up, guys, if this concept is clear. Yes. Sure. Just give me a thumbs up, guys. And one, you guys already know the fourth one, that is the periosteal arteries. And I've already mentioned about the periosteal arteries. Yes. Medical laugh. Okay. Periosteal arteries, we have already mentioned it, right? Inocosser, very good, beta. Very good. Sure. Now coming on to the next wala part, the blood supply, the arterial supply is done. Okay. Now again, guys, some important points that I wanted to discuss over here. Even the venous supply, the venous drainage, It follows the arteries, right? The veins are draining out of these bones, right? So they follow the arteries, right? They follow the arteries, okay, of the bone. Now coming on to the lymphatic vessels. Lymphatic vessels. So remember, the bones are devoid of lymph. They are devoid. They are not carrying any lymphatic vessels, okay? So they are devoid of lymphatic vessels. They are devoid of lymphatic vessels, right? They are devoid of lymphatic vessels. Apart from that, the D wala part, guys, right? Okay, let us discuss about the nerve supply. Nerves are also there, okay? Nerves are also there. So we have sensory nerve fibers, okay? We have sensory nerve fibers, and correspondingly, we have something called as sympathetic vasomotor fibers, right? Sympathetic vasomotor fibers are also there, right? Now, sensory nerve fibers, basically they supply the bone and the periosteum, right? They supply the periosteum along with the bone, and coming on to the sympathetic one, basically they accompany the arteries, okay, more inside, right? So, and one more thing, guys, the sensory nerves are basically more at the ends or the epiphyses of the bone, right? The sensory ones are more at the ends of the bone. So that is regarding about that was about the vascular supply of the bones, the blood supply, right? The arterial supply, the venous also follows the arteries. That they are devoid of limbs. They are not having lymphatic vessels, and the nerves are simply the sensory and the sympathetic supply is there. I hope this is clear to everyone. I hope this is clear to everyone, guys, over here. Yes, just give me a thumbs up in the chat box. One important part that I have to like discuss with you people. Yes, which I haven't discussed. Yes, one important concept, guys. Five more minutes I will take. Yeah, and that is something you guys have to learn right now. Guys have to learn right now. So, Hina Foster, Sabrina, very good, guys. Now there is something called as the direction of nutrient foramina. Direction of the nutrient foramen of long bones. Long bones. Now, nutrient foramen has a direction, guys, in the long bones, right? Nutrient foramen has a direction in the long bones, right? Now, you have to remember what is the direction, guys. What is the direction of the nutrient foramen? So, to the elbow I go, from the knee I flee. From the knee I flee. Sure. Let us just discuss this very important concept that I will be teaching you why I have drawn the growth plate only at one end. Let us now try to understand. To the elbow I go. Now, guys, if you just want to see over here in this diagram, now, or yes, no. Let us suppose this is the elbow joint. This is the elbow joint, right? This is the shoulder joint and this is the wrist joint. Okay? This is the shoulder joint, this is the wrist joint. To the elbow I go. Again, concept. Now, to the elbow, towards the elbow it is going, right? Towards the elbow. So the direction of the nutrient foramen, you guys already know, from shoulder joint to elbow joint. I mean, from the shoulder to the elbow, this region it is called as the arm. And in this arm region, humerus is present. In this arm region, humerus is present. Shoulder से elbow तक. ठीक है, this is the arm region, and in this arm region, humerus bone is present. Now, you guys are going to tell me what is the direction of the nutrient foramen in the humerus. What is the direction of the nutrient foramen in the humerus? चलो बताओ, जल्दी से बताओ. What is the direction of the nutrient foramen? And what will be the direction? It will be up or down? Nutrient foramen नीचे जा रहा है या ऊपर आ रहा है? बताओ. So I'm waiting, guys. Please tell me the nutrient foramen, it is going down or up. Now, guys, you can automatically see over here the nutrient foramen, it is going down. In the case of humerus, right? But in the forearm, guys, in the forearm, yes, in the forearm we have two bones, ulna and radius, and in both the bones the nutrient foramen, it is going up. Nutrient foramen, the direction it is up. The nutrient foramen, the direction it is up, and in the humerus it is down. So that is the meaning, the direction of the nutrient foramen. From the knee I flee. Now from the knee I flee. Let us just try to draw the knee also. Let us just try to draw this knee. And if you can just see over here, right? Let me draw it more in an easy way. Otherwise, you guys will like say I have not drawn it correctly. Yeah. So let us just try to draw a very simple diagram. From the knee I flee. From the knee it is going out. So yes, if you can just see over here. So let us suppose that this is the knee joint. This is the knee joint. From the knee I flee, guys. From the knee I flee, it means it is going opposite. It is going opposite like this. It is going away from the knee. From the knee I flee. It is not going towards the knee. It is going away from the knee. So in this we have the femur bone. So in the femur bone, can anyone tell me the direction of the nutrient foramen? Yes, in the femur bone, can anyone tell me the direction of the nutrient foramen? And in the leg region, we have two bones. You already know we have the tibia, and along with the tibia, we have the fibula. Yes, along with the tibia, we have the fibula. So in the femur, the direction of the nutrient foramen is up or down? Up. George Azala, very good. Yes, upward. But in the tibia and fibula, the direction of the nutrient foramen is, yes, medical love, it is right. In the tibia and fibula, the direction of the nutrient foramen is upward. In femur, ठीक है medical love, हिना कॉसेट ठीक है, but tibia और fibula में क्या है? Tibia और fibula में the direction of the nutrient foramen is down. The direction of the nutrient foramen is down. You can just see, okay? Now, yes, down in tibia and fibula. ठीक है. Now, again, why this concept is important? Now, there is something called as the growing ends of long bones. Growing ends of the long bones, right? They are opposite, be very much clear, opposite to the direction of nutrient foramen. They are opposite to the direction of nutrient foramen. The nutrient foramen, very important. The growing ends of the long bones, they are opposite to the direction of the nutrient foramen. Very important. Sure. Let me now ask you, in the case of humerus, what is the direction of the nutrient foramen and what will be the growing end? Where will be the growth cartilage present? So what is the direction of the nutrient foramen in humerus? In humerus, the direction of the nutrient foramen, it is up or down? Guys, tell me. It is up or down in the case of humerus? Yes, it is going to the elbow I go. So it is down. So the growing end will be up, opposite to the direction of nutrient foramen. So now remember, guys, I have drawn the growth cartilage only at one end. So that was the purpose, that you guys have to be very much clear कि अगर nutrient foramen का direction down है तो growing end क्या हो जाएगा? Up. Again, come on to radius and ulna. Radius and ulna. What is the direction of the nutrient foramen in radius and ulna? To the elbow I go. So it is Up. It is going up now. It is up. Yes, Sabrina, very good. It is up. What will be the direction of the growing end then? It will be down. It will be down. The growing ends of the long bones will be down. Now coming on to the femur, the direction of okay, the nutrient foramen is up. What will be the growing end? It will be down. It will be down, right? I hope this concept of direction of nutrient foramen and the growing ends of the long bones are clear to one, all of you guys. So just give me a thumbs up if today's topic it is clear to everyone over here. We have discussed the parts of the long bones. We have discussed the periosteum, the some points related to ossification, the bone marrow complete, the red and the yellow bone marrow, the types of the epiphysis, pressure, traction, atavistic, aberrant, direction of the nutrient foramen. And yes, we have already discussed the blood supply of the long bones in detail, in extensive detail. We have discussed a little bit about the nerve, veins, and lymphatic vessels as well. So I hope you all understood today's lecture. See the medical love, please. I will be again focusing on the same point. Please follow the classes regularly, right? The thing is, in the first year and the second year, the third year, please don't go for any such apps. I would request first try to see there is no replacement of any books. Reading books, doing questions from the book. Okay, the textbook is your primary source of information, right? There is no replacement of the textbook. Even after the lectures, I have always told you, no guys, go with the textbook. You have ample number of no, you have ample time to know read the books and everything. So please just don't try to skip it at any cost. Okay, so follow the lecture, read the books, take out some important points which I have not discussed, or you have some doubts, you can just text to me on my Instagram handle as well. Okay, you can connect to me on my Instagram handle for your doubts. It is Abhijit Kumar 7859, right? You can connect to me on my Instagram handle, okay, for your doubts, and please just go with the flow, whatever I'm teaching, right? So thank you guys and good night everyone. It's already too late. Yeah.